Alright guys, so we're gonna finish up with the nose and the tongue of our sensory system today, and then this will wrap up all of the notes for our unit 3. So we're just gonna jump on in, look at the nose first, and then we'll look at the tongue. This is not a very big section either, so this one's gonna be smaller than the ear. So you should be able to knock this out today, and then have plenty of time to study for the rest of today and tomorrow for your unit 3 test. Right, so for our nose, we have our nasal cavity. This is going to be the sense of smell comes from the olfactory region of the nasal cavity in itself. So those little small hair projections that trap large dust particles from entering the nose are going to be known as our cilia, or as you probably know them as our nose hair. Then we have our septum. This is going to be the portion that divides the nose into right and left halves. So whenever you get your septum pierced, you have that nose ring in between those two nostrils. And then here you have your olfactory bulb. This is going to be a structure located at the bottom of each cerebral hemisphere that processes information about odors. So the smell would enter in here, and that olfactory bulb is going to generate that smell, see what it is, and then it's going to send it to the brain. The nose structure itself provides our sense of smell, but it also accounts for 90% of our sense of taste. So we taste really how we smell it. Some disorders associated with the nose. We have our deviated nasal septum. So you can see here, this is where the bend in the cartilage of the septum kind of blocks off one of those nostrils. So it blocks the airflow and it makes it difficult to sleep, to breathe, does cause some snoring, can cause nosebleeds and headaches. You do have to get this surgically repaired. And then you have your nasal polypus. This is going to be the growth in the nasal cavity associated with rhinitis. So this is going to be, if it's severe enough, you'll get surgical removal of that as well. And then our rhinitis is going to be known as like a runny nose. This is going to be inflammation of the lining of the nose, causing nasal congestion, drainage, sneezing, itching. It's usually caused by allergies, infections, fumes, odors, or drugs. Usually, eliminating any of those allergens or exposures is the best way to get rid of that rhinitis. And then you have your structures and functions of the tongue. So our tongue itself is one mass of a muscle tissue. So we have those little papillas or our taste buds on the surface of the tongue that collects and contains that taste when we eat something. And then there's receptors in each one of those taste buds that sends a stimuli through our three cranial nerves to the cerebral cortex for that interpretation of what we are eating and tasting. So we have three disorders that go along with our tongue. We have glossitis. So this is going to be inflammation of the tongue, usually caused by um, a allergen that just kind of irritates the tongue. We also have strawberry tongue. This is where your tongue swells. Usually get red, bumpy tongue with enlarged taste buds. Taste buds. It can be caused by scarlet fever, allergies, toxic shock, vitamin B12 deficiency, and Kawasaki disease. And then here you can see thrush. This is going to be an oral yeast infection that causes white lesions on the tongue and inner cheeks. This is very common in babies and people with immune deficiencies and those who use steroid sprays for our asthma. And then our last sensory function is skin. Just know that touch is part of the sensory system in itself, but we're not going to go into the skin just because we've already looked at that integumentary system. So this will wrap up, like I said, our 3.04 notes and wrap up that unit 3. So take the rest of the day, take tomorrow, study for your tests, I can't emphasize enough that it is a bigger unit, so it is a bigger test, okay?